Hi there, welcome to this video. Suiza here, and today I'm going to talk to you about the pathophysiology of pancreatitis. Now before we get started, let's find out what you already know. So which of the following is secreted by the pancreas? Is it insulin, BMP, adrenaline, or dopamine? Feel free to pause this video and take a moment to think about the answer. And the answer is insulin. So insulin along with glucagon forms part of the endocrine function of the pancreas, which is involved in regulating the blood sugar levels. Next question. Which of the following is a common cause of pancreatitis? Is it stroke, MI, gallstones, or DVTs? The answer is gallstones, and gallstones and alcohol are the two commonest causes of pancreatitis. Which of the following is a key symptom seen in pancreatitis? Excessive alcohol consumption, bone fractures, malnutrition, or epigastric pain radiating to the back? And the answer is D. It's important to always look out for this sign when diagnosing pancreatitis. Don't worry if you didn't know the answers to these questions, because we're going to revisit these questions at the end of the video. So, we're going to have a little look at what pancreatitis is, some of the symptoms, pathophysiology and some of the causes, things to think about during a history and clinical examination, and we're going to revisit those questions again. So, what is pancreatitis? So anything sort of ending with itis, you think inflammation, and hence inflammation of the pancreas. And pancreatitis can be acute or chronic. And as you can imagine, it disturbs the normal function of the pancreas. These include like the exocrine function, which is carried out by the acinar cells, and these produce the digestive enzymes for protein, carbohydrate, and fat metabolism. There's also the endocrine function of the pancreas, and this is carried out by the islets of Langerhans, which produce hormones that regulate blood sugar levels. Hopefully you can see in the diagram you've got the beta cells, which is the most abundant type of cell in the islets of Langerhans, and these produce insulin, and this is secreted during hyperglycemia. You've also got the alpha cells, which secrete glucagon, and this is secreted during times of hypoglycemia. You've got the delta cells, which secrete somatostatin, and these can inhibit insulin and glucagon. And you've also got your pancreatic polypeptide cells, which produce pancreatic polypeptide, and this plays a role in both the endocrine and exocrine functions of the pancreas. So, some of the symptoms. So in acute pancreatitis, you'll get that acute upper abdominal, so epigastric pain, which radiates to the back. You can get nausea and vomiting, tachycardia, loss of appetite, and fever. Now in chronic pancreatitis, you will tend to get some of the symptoms of acute pancreatitis as well as additional symptoms. So you'll get that continuous upper abdominal pain which radiates to the back, nausea and vomiting. You can get steatorrhea, which is those oily, smelly stools which tend to be hard to flush, malnutrition, and unintentional weight loss. So the pathophysiology of pancreatitis. So normally the pancreas secretes enzymes in inactive forms, and these are known as zymogens. But in pancreatitis, you'll get an obstruction of the zymogen secretion, which leads to premature activation of these enzymes, like trypsin. And this can then lead to autodigestion of the pancreas. Now in acute pancreatitis, this damage tends to be reversible, whereas in chronic pancreatitis, this damage is actually irreversible, and that's due to the repeated attacks which cause like fibrosis and scarring and calcification. So causes of pancreatitis. So alcohol is one of the common causes of pancreatitis, and it's thought that heavy drinking leads to repeated attacks of acute pancreatitis, which can then eventually lead to chronic pancreatitis. The other common cause of pancreatitis is gallstones, and this is especially the case when a gallstone gets lodged in the common bile duct, especially in the part just after where the pancreatic duct joins. There are other causes of pancreatitis like cystic fibrosis, so the mutations in the CFTR gene leads to thick, sticky secretions, for example, like the ones that are secreted by the pancreas. Infection or trauma can cause pancreatitis. Abdominal injury or surgery. Family history of pancreatitis. And certain medications like azathioprine or tetracycline. So a history and clinical examination of pancreatitis. In the history, you want to listen out for that epigastric sharp pain that radiates to the back, because that's classically how pancreatitis presents. The patient might say that the pain is alleviated by leaning forward or in the fetal position. It's worth asking about any history of biliary disease, pancreatitis, or gallstones. And definitely worth asking about any history of alcohol abuse or excessive drinking. On clinical examination, you want to look out for tenderness in the epigastric region. And there's certain signs associated with pancreatitis. One of them is Cullen's sign, and this is when you get bruising in the hypogastric region. And another sign is Gray Turner's sign, and that's when you get bruising in the flanks. Okay, so let's have another look at those questions. So which of the following is secreted by the pancreas? Insulin, BNP, adrenaline, or dopamine? And hopefully you remember that it's actually insulin. And insulin and glucagon both play a role in the endocrine function of the pancreas in regulating blood sugar levels. Next question, which of the following is a common cause of pancreatitis? Stroke, MI, gallstones, or DVT? And hopefully you remember that it's actually gallstones, and along with alcohol, these are the commonest causes of pancreatitis. And finally, which of the following is a key symptom seen in pancreatitis? Excessive alcohol consumption, bone fractures, malnutrition, or epigastric pain radiating to the back? The answer is obviously D. This is classically how pancreatitis might present. So it's worth looking out for this when trying to diagnose pancreatitis. And that concludes this pathophysiology video on pancreatitis. Thanks very much for listening, and I hope it was helpful. Take care now.